Today on Riverside Strong, we'll focus on mental health and how our multidisciplinary team at Riverside Behavioral Health Center is working to support, teach, and heal adults and adolescents and their families and loved ones as they cope with and work to overcome an array of mental health issues and addictions. We'll learn more about new insights and research that are putting coping skills and self-care at the center of mental health treatment. This and so much more on this episode of Riverside Strong.
Adversity, disasters, emergencies, crisis. These are not the things that create character. No, these are the times, the moments that reveal character. You know what it also reveals? Compassion, empathy, humor, creativity, innovation, kindness, perseverance, knowledge, and strength. Perhaps strength most of all. We are Riverside Strong.
Welcome to Riverside Strong, where we examine a wide array of medical issues and learn from the medical professionals who treat them. I'm your host, Ashley Snyder. Today we'll visit Riverside Behavioral Health Center in Hampton, Virginia, where a team of therapists, nurses, and support team members work to help adults and adolescents overcome mental health crises, from depression to psychosis to addiction. We'll talk about the stigma and prejudice that keeps people from reaching out for help and share ways you can help yourself or a loved one deal with mental health issues. Each year, 1 in 5 Americans experiences a serious challenge with their mental health, and almost half of all adolescents struggle with depression, anxiety, or other issues before they reach adulthood. The COVID pandemic has increased levels of isolation, stress, anxiety, and grief across every age group. And as a result, we're seeing increased rates of depression, suicide, substance abuse, and addiction. But what is mental health? How can we meet and overcome these mental health challenges? Research is providing some surprising answers.
Mental health includes emotional, psychological, and social well-being. It impacts how we think, feel, and how we respond to different circumstances. So our goal here is to really care for the whole person and really care about mental health in totality.
I think we're working towards a greater understanding of mental health as opposed to mental illness. As we find out more things just physiologically with people, what goes into a holistic role of looking at how mental health issues develop within a person. There's a lot of factors that 40 years ago we didn't know about right now. I mean, it's just some of the research and developments that we're finding about the brain. The role of neurotransmitters is one area we are just gaining more and more understanding of, that we just didn't have the technology. The role of traumatic brain injury in something as simple as impulse control, and being able to identify patients who are suffering from a problem that's not a mental health problem, but is more of a physiological or neurological problem. We suspect that 55% of people in prison right now are suffering from a traumatic brain injury. They may have been caused when they were a child, and they may not understand, and that makes it difficult for them to impulse control. It's driven by your behavior, but that traumatic brain injury is limiting your ability to successfully deal with that impulse.
Over the past couple of years, we had COVID occurring. And I initially thought that when COVID started that our number of patients in the hospital would probably drop for about a week or two, maybe 3 weeks. The number of kids we had in the hospital was pretty low. And then right after that, the number of kids in the hospital started going up. And the reason was because they're isolated. The kids could not see their friends. They lost contact with some friends, even though, they have cell phones, you have Zoom, that kind of a thing, but those things weren't big at the beginning of COVID.
I prefer to work with a patient from the standpoint of mental health, because that allows me to focus on their strengths rather than mental illness, which denotes weaknesses that the patient may be bringing into the situation. all of the stigma that's carried with mental illness, where mental health allows the patient to feel that sense of empowerment to be able to control their symptoms, to be able to put strategies in place for themselves, to give them a chance to kind of think through where they've been at in their life and the things that may not have worked for them.
And our goal is to help provide that education, not just in stabilizing their mood and their behavior, but also educating them on what resources are available to them, because it doesn't just end here. This is sometimes where it starts. They'll start their treatment here, and one of the things that we really reinforce here is that this is the beginning of your treatment, and that as you stabilize here, we want you to go forward in your aftercare, whether that be outpatient, maybe a more long-term inpatient, which could be a 30 or 60-day program, just to continue on that process to realize that mental health is something that we all should continue to strive for. It's not something that you just do once every week or once every few years. This is something that we should strive for every single day of our lives.
Just down to each staff member, we all struggle with something. So even, telling our stories and, telling the patient, yeah, I've struggled with that too. This is what I did, just being real with our patients and trying to destigmatize it, because like I said, it's no different than going to your provider for a medical issue.
We have a great team here at Riverside Behavioral Health, a lot of caring people who want to help folks. That's their mission, that's why they wake up in the beginning of the day, and that's why they go home at the end of the day and come back tomorrow and do it all over again.
We are Riverside Strong. At Riverside, we are here to be your healthcare partner throughout your life. We are here for you, for an annual wellness visit, to help you manage your health conditions, or to figure out your next steps when unexpected situations arise. We are here, when and where you need us, even online, offering easy, secure access to your health records, appointment scheduling, video visits, and more. It all starts with choosing Riverside as your healthcare partner. Call or visit us online today.
Welcome back to Riverside Strong. Riverside Behavioral Health Center provides intensive inpatient care for adults who are experiencing a mental health crisis. What does that care involve? We'll talk to doctors, nurses, and support team members to get a better understanding of the care that can help patients emerge from a crisis stronger and more resilient.
At Riverside Behavioral Health Center, we have several different treatment options for adults.
So we deal with patients who come here for a variety of reasons. We definitely have a large group of folks who come in voluntarily. They recognize that they're running into a problem and they need some help kind of clarifying things, setting some goals for themselves, reconnecting with others. And we have folks who, for whatever reason, have to come in and stay for a while for their own safety, for the safety of others. We are involved with law enforcement in those cases. We want to provide an environment for them where we can keep them safe for themselves, safe from others. We can help them gain some clarity to their situation, whether that be reality orientation for the patient for a few days, providing some basic human needs to them that they may not have been getting while they were out in society.
So we try to get a good picture of what the past health looks like so we can see where they are currently, and that kind of helps us understand what we need to address right now and maybe even what we need to set them up to address once they leave here. Maybe they haven't been to see a primary care doctor in quite a while. Maybe they haven't taken their medications in a while. And so a lot of times we're restarting. We're giving them a medical physical because some of them have not been to see a medical professional in some time.
The average length of stay is like 5 to 7 days. So we try and compact as much of our work and build that rapport with the patient as quickly as possible that allows them to feel free enough to work through what they want to achieve. We have a number of licensed clinicians as members of our staff. The team works with patients on identifying goals that they would like to achieve while they're here at the facility and also when they move into an outpatient setting after discharge. Some of the things we work on with patients are ways to manage their mood, ways to protect themselves from self-harm, impulse control, anger management, One basic strategy we use is daily goal setting. So giving the patient a chance to reflect on what steps they need to take to achieve those goals for their day. We work with what's known as SMART goals, which are small, measurable, achievable, realistic, and timely goals. So we don't want a patient setting a goal that's so far in the future that they kind of lose their way while they're trying to meet that goal. We use a lot of evidence-based practices to build the trust with the patient. We use a lot of evidence-based techniques that there's a lot of good clinical proof for what we're doing here and how it'll help the patient to be successful.
I think we get so overwhelmed in our day-to-day with the stressors of the things we need to do, and they're there. Work, our kids, financial stressors, they're things that we have to deal with. They're not going to go away. So how do we find that middle path to balance the stressors that we're dealing with, that we need to address, while also taking care of ourselves? A lot of times with my patients, we talk about the word selfishness. And we talk about stigma and try to remove the stigma from the word selfishness. Now, when I think about that word, I don't mean it in terms of hurting other people or neglecting other people. But we can't take care of others until we take care of ourselves.
So several of the different therapies that we offer here are recreation therapy, art therapy.
Art therapy is a means of treatment that clients are allowed to interact with art media, and they can express their feelings in a visual way. It allows them to kind of gain distance from different traumas that they might experience through expressing it through the artwork, as opposed to regular verbal therapy. I did have a client come into one of our sessions, and they were just you could tell they were kind of ramping up. They were really upset. They had something happen previous to group. They were feeling some kind of way about it. They started drawing, and you could tell they were still agitated. And I kind of offered them a different form of art making, tearing paper and then making it into a collage, because the tearing paper allows them to sublimate that anger into the force of ripping the paper. And they were able to use that and kind of calm down. So we can offer them directives that might not necessarily realize they needed at the moment, but sometimes it just kind of offers that little helping hand that they might need to kind of deal with what they're going through.
Physical fitness is part of their journey. It's when you're doing mental health, you also have to be physically healthy as well. So if you have those aches and pains, you might be more depressed, and then if you're depressed, you get aches and pains, so you want to kind of work out all of those kinks as well. And staying active, so we encourage walking, meditation. We might do some yoga stretches, chair exercises, come to the gym and get basketball. We have hula hoops. We might encourage soccer games.
I think in a place like Riverside Behavioral Health Center, it's integral that from the minute you walk in that door into admissions, that there's that air of trust. It's with the admissions coordinator, it's with the nurse that walks you onto the unit and discusses what the programming is. It's the tech that helps walk you to your room and assists you with any of your general care needs, to the therapists. That trust is extremely important to feel like, if anything else, no matter what else is going wrong in your world, this is the one area, the one bastion of safety and support where you feel like I can really be me, I can feel safe and know that I'm going to be taken care of in a safe way. That if I'm feeling overwhelmed with emotions and my behaviors are becoming intensified, I know I can trust you to help me.
We're Riverside Strong.
Like adults, adolescents 12 to 18 years old can experience a mental health crisis and need inpatient care. These young people are not children, but not yet adults, and their brains are still developing. What is the goal of treatment at Riverside Behavioral Health Center? Helping them learn the lifetime coping skills and the resilience they need to meet future challenges.
We also provide services for adolescents aged 12 through 18. This is on the inpatient side. So again, it's that highest level of care. It's that really intensive inpatient treatment where individuals meet with doctors or psychiatric mental health nurse practitioners, as well as psychiatric therapists, as well as nurses, of course, around the clock to help support their needs during that really critical time.
For a caregiver or for a parent to get their child to come to Riverside, the biggest thing is to sit down and to talk to them. To talk to them about the emotions that they're experiencing. If they feel like they want to hurt themselves or want to hurt somebody else, if you notice that they're journaling about things that seem to be darker, or if they're drawing kind of dark pictures, talk to them about that. Tell them, hey, maybe we need to go to the hospital to talk to a psychiatrist there or a therapist there, and maybe even start medication to get the help that you need so we can get these emotions and kind of things that you're feeling to calm down some.
Adolescence is extremely challenging, getting them to open up and feel that they aren't being judged. I actually think that sometimes it's even more challenging than with adults, to get them to trust, to get them to feel like they can open up about some very intense experiences, not just about anxiety and depression as a whole, but trauma.
See, a lot of the kids that we see on the unit, kind of with that lack of resilience, is something that you see in parents. So if there's a trauma that happens, there's not as much resilience there. The child picks up on that and they learn how to deal with that situation just like the parents dealt with it, or just like the, or like an older sibling dealt with it, or a guardian dealt with it. So if you can teach resilience early and kind of show that child what they need to do to deal in those situations, then down the road they'll generally do better. On our unit, we teach a lot of the coping mechanisms to kids. There's a list of 101, there are actually more than that, but we try to teach those kids how to deal with an emotional situation and try to react generally in a way that it's something that they won't regret kind of down the road. So of course there are going to be emotional situations for everybody. Do you want to react impulsively or emotionally in that situation, or do you want to react by kind of sitting back, thinking about it first, kind of taking in what's going on around you and then responding in that way? A lot of times if you use what's called wise mind as opposed to emotional mind, if you respond in a, and it's okay to respond both ways, but if you respond in a wise mind kind of a situation, or in a wise mind reaction, then you generally will have a better outcome than you would if you respond emotionally to a situation. It's important to look at things from multiple aspects. So medications may help some of the symptoms. You're gonna need something beyond medication sometimes. And sometimes medication's not the answer. Sometimes it's just therapy. Sometimes it's for people who are interested in exercising. Sometimes it's yoga, like we're saying, recreational therapy. I have kids all the time who tell me on the unit, you know, to be able to go home, I have to be happy. No, you don't have to be happy. Not everybody's happy 24/7. It's okay to feel whatever emotions you're feeling. If you're feeling sad, it's okay to feel sad. If you're feeling happy, it's okay to feel happy. If you're mad, you're angry, you're upset, it's okay to feel that way. If we weren't supposed to have these emotions, we wouldn't be made to have them. So we try to get the children to realize, or those kids to realize, that it's okay to experience those emotions, but when you are feeling those emotions, you respond appropriately and you talk to somebody about it, especially if it's something where you have a thought where you want to hurt yourself or you want to hurt somebody else.
My hope would be that they can talk to their parents about this, talk with their outpatient provider, because that relationship is what's most important. That relationship with their caregiver is going to be the most important, and that's what we try to set the groundwork here with the adolescents, is developing that communication pattern.
A kid that comes here, they know what happens here, they know they're going to get treatment, they're well aware of the process, and then later in life, if they realize they're having anxiety, depression, they know that they can go, they can ask for help. It's not really taboo anymore. That stigma is gone.
We are Riverside Strong.
Substance abuse and addiction are major threats to mental health. The COVID pandemic and the isolation and stress it caused has triggered substantial increases in drug use and in deaths due to drug overdoses. Riverside Behavioral Health Center has intensive inpatient and outpatient programs to help users get clean and stay free of addiction.
At our BHC, we really focus on providing individualized and holistic care. If a patient's admitted to our facility or one of our programs and is struggling with both substance use and mental illness, then we have the team really structured to meet those individualized needs.
So the addictions programs that we have here are for adults, treat adolescents with addiction on an outpatient side. So we have 2 programs, generally lasting a few weeks at a time, where people go through groups. They can also see a medication provider as well, because of course with addiction sometimes there are other mental health issues that go along with it, and sometimes those things need to be treated as well. But those programs are for people who are addicted to any substance. So it can be alcohol, it can be marijuana, it can be cocaine. And if they come here, we can kind of screen everybody or screen that person to see if going straight to that addiction program is the right thing for them, or if we need to admit them to the inpatient unit first to detox and then transfer them to that program. It can be really hard on loved ones. I mean, to see their child, whether it's a teenager or the person is an adult, going through addiction and watching them literally go from sometimes a functioning person down to the point where they can't function is really trying for people. We have caregivers who want their child, or like I said, whether it's an adolescent or an adult, to go to an addictions program, and they don't want to. And they want this person to get better so that they don't end up passing away on the street or passing away from an overdose, an accidental overdose. They want the person to get better, but also the adolescent or the person who's experiencing it has got to want to get better. And if they don't want to, you can't make anybody do those things.
My past relationships with my parents, with my ex-husband, with my siblings, I think that it helps me to be more empathetic with my patients, kind of get a better understanding of how their addiction has affected others, and kind of give them some insight on what it could look like if it progresses, how it's maybe affected their loved ones in a way that they don't understand or just haven't recognized yet. So I think that the individual therapy portion, they're able to confront a lot of internal issues that maybe they're not as open to sharing within a group therapy. And then we have our peer recovery specialist who kind of takes that role as, I've been there, you know, I can help you see how to change or what I did. And then you have the therapists who are there to educate you on everything and tell you, you know, how this affects your brain, how this affects different organs, you know, the cycle of addiction, the relapse prevention models. We have other therapists who come in who do our recreational therapist. She helps teaches you mechanisms to do when you're alone and you're bored to help prevent that relapse from occurring. We have our pharmacists come in and teach you why medication management is so important. So I almost kind of teach patients how to live successfully a daily routine without using drugs and alcohol. Ways to cope with external and internal stressors, things to do to keep them busy, to take their mind off of intrusive thoughts, educating them on the impacts of their addiction, whether it be alcohol or illicit substances, the different diseases and conflicts medically that it could lead to, like cirrhosis, wet brain, neuropathy, any kind of physical or emotional, you know, damage that drugs and alcohol do cause, because we know that once you're dependent on an illicit substance or alcohol, everything kind of shifts in the brain, and that's when your mental health starts to deteriorate.
So I like to say that I'm an emotional support human. I support people who are coming from active addiction into recovery. I told somebody the other day he had all these problems. He had court, he had another court, he had a probation officer, he has a parole officer, he has another ticket, he has his parents, he's all these problems. And I said, how do you eat an elephant? And he said, I don't know. And I said, one bite at a time. So we're just gonna take one problem at a time and solve, you know, talk to the probation officer, find you a recovery home to go to. So he's gonna go from bed to bed, and what that means here is from a bed in our hospital to a 30-day program. We want you to get better. Everything we do and say here, we want you to succeed. We care for you like we care for our own family. You can do this, that anybody can do this. If I can do this, anybody can do this. Because my family told me I was hopeless. I was hopeless.
We've taken a look at options for adults and adolescents who are facing a mental health crisis or addiction. But what can you do if you or a loved one is struggling with a mental health challenge?
We don't realize sometimes those subtle little triggers, those little subtle things that we're not doing that can lead to all of a sudden now I'm not getting out of bed anymore. I haven't been to work in a week. I haven't showered in a week. And you don't realize that it all kind of started with those little things that, you know, I didn't necessarily respond to that phone call a few days ago, or I maybe left work a little earlier than because I had some thoughts, some feelings going on, and I didn't know what to do with it. I didn't know who to talk to. And I think that's where things can kind of gradually lead into what we may call mental illness or a mental health condition in which we need to get support when depression and sadness get to a level where it's debilitating, where we don't want to eat or we don't get enough sleep, or maybe we sleep too much. Those are warning signs that tell us, hey, we need to go get some help.
If you struggle with feelings of hopelessness, worthlessness, maybe some circumstances in your lifestyle has changed and now you have thoughts of wanting to harm yourself, or that life would be better if you're not here, or thoughts of going to sleep and not waking up. If you have those types of thoughts, there's help for you. If you feel like you can't sleep because your mind is always racing, running to the next thought, there's help for you. If you have thoughts of harming other people that you know you don't want to have or don't want to act on, that there's help for that also.
And then the next step is, what do I do? I think some people get stuck in, okay, now that I know, what am I supposed to do with that? They're afraid to tell their spouse or their loved one or their parent, and then they don't know who to turn to.
You don't always have to say anything back to the person. Sometimes just listen. Just listen. Silence is amazing. And then just let that person talk about what's going on with themselves. So it's not always about a back and forth. Sometimes it's about just listening. Because if somebody says that they're going to hurt themselves or hurt somebody else, is take what that person's saying seriously. Some people they will hear it, they'll laugh it off or say you're not going to do that or something like that, and then down the road it happens. So I would say if anybody says anything like that, take it seriously.
If you or someone you know are interested or feel like you need services from Riverside Behavioral Health Center, we do accept walk-ins 24 hours a day, 7 days a week. We are just like a general hospital. We do not close, so there are coordinators around the clock that can help. If it's more comfortable for you to call us first, then we are also available by phone.
If you need help, seek help. If you need to come to the hospital, and doesn't mean if you come to the hospital that you're going to be admitted. Not everybody's admitted to the hospital. A lot of people are afraid of that. So if you come to the hospital, sometimes you can come and they will discuss with you kind of the issues that are going on with you. They'll call one of the providers to see if you need to be admitted to the hospital or not. But if you need help, come and get help. We will try to do whatever we can to help you. Once you get into the hospital, again, you'll get therapy, medication management if necessary, and then once you leave, we'll set you up with whatever outpatient care you need. And if that's going to the addictions program here, then that's fine. If you need to go to a psychiatrist elsewhere or a therapist elsewhere, or you need a substance abuse treatment program after this, that's more of kind of like an inpatient program, we can help you set that up.
If you or someone you love is facing a challenge with their mental health, here's how to get help. Riverside Behavioral Health Center is open 24/7. You can reach the crisis text line by texting TALK to 741-741 or call the National Suicide Prevention Lifeline at 1-800-273-TALK. For more information on Riverside Health System services and providers, please visit riversideonline.com. Missed our past episodes? Catch them all on yourview.com. Until next time, stay healthy and stay informed with Riverside Strong.
We're Riverside Strong.